Hold on. So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors?
And I'm
the American Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody
industry.
but you, Senator. But you know what? When you ran for president, we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were already president. You had $1 billion behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry.
What happens when Bernie Sanders puts Robert F. Kennedy Jr. on the spot and demands he choose between the entire medical community or his own conspiracy claims? Well, we just found out in a fiery Senate hearing. Sanders didn't just press him, he torched him, exposing contradictions, calling out attacks on doctors, and forcing Kennedy to answer for his words. Let's break down why this clash matters and what it means for the future of healthcare in America.
I just want to pick up on Senator Warren's point. Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no. I'm giving a quote. And I asked her twice.
No, 1 second. And you're also repeating now that she is a liar, correct? What you wrote in the Wall Street Journal.
If she wrote that I fired her because she refused to sign on in advance for the ACIP committee, no, that's not accurate.
All right, so you're calling her a liar, and I look forward to her coming before the Health Committee, maybe this committee as well. All right, Mr. Secretary, I've got a bunch of questions. Appreciate brevity in answering it. So-called beautiful bill threw 15 million Americans off of health care, substantially raised premiums, and is going to have a terrible impact on nursing homes, community health centers, rural hospitals all over America. Very briefly, is that really making America healthy again?
It's going to be the biggest infusion of federal dollars into rural health care in American history.
Yeah, you know why? Because you're cutting $150 billion for rural hospitals. You're putting $50 billion back. That's not an infusion. That's a loss of $100 billion. All right, next question. President Trump, who I don't usually agree with, called COVID vaccines, quote, one of the greatest miracles in the history of modern-day medicine that saved tens of millions of lives worldwide. Scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use. Secretary Kennedy, are President Trump and the medical community right, or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
No, first of all, I didn't say that. I said that in terms of affairs reports a while ago. I said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine was perfectly matched to the virus that was circulating then. And I have no idea how many lives it saved, but it saved quite a few.
You know, what I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, is we've got the entire medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are who are the organizations that are agreeing with you in casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz. then I prescribe.
So you got a few doctors who agree with you, and I'm giving you the
Not a
name.
few doctors. What you're talking about, there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical
Oh, hold on. So
industry.
you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And I'm
the
telling
American
you,
Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody but you, Senator. But you know what? When you ran for president, we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were already president, you got a billionaire behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. And I think the issue now...
I don't even know what you're talking about.
Well, I think you do know what I'm talking about.
I don't know what you're talking about.
The issue is every time anyone disagrees with you...
Are you saying the pharmaceutical industry was supporting my presidential campaign?
I'm saying,
I don't think so.
I'm not saying that. I'm saying that the pharmaceutical industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people, is corrupt because they disagree with you is an insult to the American people.
Listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr. Oz.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists.
Yeah.
And Sanders called Kennedy out for exactly that. He asked, "Are you really telling the American people not to trust their doctors? Are you really suggesting the AMA, the pediatrics associations, and the heart specialists are all bought out by Big Pharma?" Kennedy doubled down, saying the medical establishment has been co-opted by pharmaceutical greed. But here's the difference. Bernie Sanders has been fighting Big Pharma his entire career. He knows they're greedy. He knows they gouge patients and buy influence. He has made it one of his central crusades. But Sanders makes a crucial distinction. Criticizing corporate greed and fighting for systemic reform is not the same thing as telling people that every doctor, every pediatrician, every public health association is untrustworthy. Sanders said it plainly. To suggest that every institution is corrupt because they disagree with you is an insult. And he's right. Because what Kennedy is pushing isn't reform. It's nihilism. It's the idea that no one can be trusted, that all science is suspect, and that only he and a handful of hand-picked contrarians are telling you the truth. That's not how you run public health. That's how you dismantle it. When the health secretary suggests your doctor is compromised, parents start to doubt vaccines for their kids. Seniors start ignoring the American Heart Association. Everyday people start questioning whether their pediatrician or cardiologist is working for them or for Big Pharma. Trust, which is the very foundation of medicine, begins to crumble. And when trust erodes, public health collapses. Sanders saw that danger, and that's why he pressed Kennedy so hard. This wasn't about defending pharmaceutical companies. It was about defending the credibility of science itself. Sanders understands that if you undermine institutions like the AMA or the Academy of Pediatrics, you're not just weakening an argument, you're risking lives. Now, to be fair, Kennedy's critique of Big Pharma has a kernel of truth. The pharmaceutical industry is greedy. It does corrupt the political process. It charges Americans the highest drug prices in the world. Sanders agrees with all of that, and so do I. But here's the key difference. Sanders believes in reforming the system to work for people. Kennedy, by contrast, uses the reality of pharma greed to justify casting doubt on the entire scientific establishment. It's one thing to say we need to break up monopolies and regulate prices. It's another to say your doctor can't be trusted. One is constructive reform, the other is reckless distrust. And that's why this exchange was so important, because it revealed the stakes. When Kennedy was pressed to pick between Donald Trump and the medical community, he couldn't bring himself to side with the science. He retreated into ambiguity, saying the vaccine saved quite a few. When he was asked who stands with him, he could only point to a few allies, while Sanders stood with the weight of every major medical institution. And when Sanders challenged the idea that everyone is corrupt, Kennedy kept pushing the narrative that only he sees the truth. Folks, buckle up, because we just witnessed one of the most explosive Senate hearings of the year. Senator Bernie Sanders, never one to mince words, went head-to-head with Health Secretary Robert F. Kennedy Jr. over his repeated attacks on America's leading medical institutions. And let me tell you, Sanders torched him. This wasn't just political theater. It was a test of credibility, trust, and truth. Because when the person leading America's health policy is openly accusing major medical institutions like the American Medical Association, the American Academy of Pediatrics, and the American Heart Association of being co-opted and corrupt, you've got a big problem. And Sanders made sure the American people saw that problem in the clearest possible light. The hearing started with Sanders pressing Kennedy about his firing of Dr. Susan Monarez, the former director of the CDC. Monarez had written in the Wall Street Journal that she was removed from her position because she refused to pre-approve changes to the Vaccine Advisory Committee. Sanders, always direct, asked Kennedy, "So you're calling her a liar?" Kennedy tried to walk a fine line, but Sanders didn't let him squirm away. If Monarez says one thing and Kennedy says another, then either she's lying or Kennedy is. Sanders made sure the public understood the stakes. Kennedy is essentially accusing the nation's former top CDC official of dishonesty. And if you're trying to lead the nation's health response, undermining your own former officials is a dangerous way to start. Then Sanders pivoted to Kennedy's so-called beautiful healthcare bill. And here, Sanders' years of experience and laser focus came through. He pointed out that this bill would throw 15 million Americans off of healthcare coverage, raise premiums, and devastate nursing homes, community health centers, and rural hospitals across the country. Kennedy tried to spin it as the biggest infusion of federal dollars into rural healthcare in American history. But Sanders didn't just let the rhetoric stand. He broke down the math. The bill cuts $150 billion for rural hospitals and only puts $50 billion back in. That's not an infusion. That's a $100 billion net loss. It's like robbing someone of $150 and giving them back $50, then patting yourself on the back for your generosity. Sanders made it clear that this bill doesn't make America healthy again. It guts healthcare under the guise of reform. But the real fireworks came when the topic shifted to vaccines. Sanders, in classic fashion, came prepared with receipts. He quoted Donald Trump, yes, Donald Trump, who said that COVID vaccines were one of the greatest miracles in modern medicine and that they saved tens of millions of lives worldwide. The scientific community overwhelmingly agrees. A Lancet study found vaccines prevented almost 20 million deaths in their first year alone. That's not some partisan talking point. That's peer-reviewed science. So Sanders asked Kennedy the question that cut right to the heart of it. Is Trump right, or are you right? Kennedy, who has built his public brand around vaccine skepticism, tried to sidestep. He praised Trump's extraordinary leadership and said he thought Trump deserved a Nobel Prize. But when pressed on whether vaccines saved millions of lives, Kennedy could only muster, "It saved quite a few." Quite a few. That's the line from the Health Secretary of the United States about vaccines that kept our hospitals from collapsing and saved countless lives. That hesitation, that refusal to acknowledge the scientific consensus, revealed exactly where Kennedy stands and how dangerous his stance really is for public trust. Sanders wasn't finished. He laid out the contrast in stark terms. On one side, you have the American Medical Association, the American Academy of Pediatrics, the American Public Health Association, the American Heart Association, every major body of medical experts in this country, representing hundreds of thousands of doctors, nurses, and scientists. They all agree vaccines are safe and effective. On the other side, Kennedy lists a handful of individuals, Marty Makary, Jay Bhattacharya, Dr. Oz, and Vinay Prasad. Now, these are not nobodies. They're real physicians. But let's be clear. When you set up a few contrarian doctors against the overwhelming consensus of the medical community, that's not balance. That's cherry picking. That's elevating fringe dissent and presenting it as if it weighs as much as the mountain of evidence and expertise standing on the other side.